Let's talk first about blood pressure. That's so common. So many people, I don't have numbers, but a lot of you are dealing with high blood pressure. We see you in clinic, we're bringing you back over and over again, checking your blood pressure and adjusting medications. But what can you do at home to keep the blood pressure controlled? So we'll talk first about why. Why do we get high blood pressure? And the first thing is genetics. If it's in your family, you're more likely to have it. Another thing is getting older. So blood vessels naturally get stiffer with age. And so as the blood vessels stiffen, the pressure goes up. We really can't do much about those two things, family history and getting older. We will all get older, by God's grace. So let's talk about the things that we can do something about. And the first one that we can do something about is our diet. So when your diet is high in sodium, which is salt, let's just say salt, high salt diet, low in potassium. So potassium is a different kind of salt, but it's one that's better for blood pressure. You find it in things like bananas and kiwi and things like that. So a diet that's high in sodium will cause the blood pressure to be high. A diet that's low in potassium will cause the blood pressure to be high. A diet that's high in unhealthy fats can cause the blood pressure to be high. And a diet that is just high in calories, eating a lot of food, can also cause the blood pressure to be high. So by modifying diet, eating fewer calories, eating less salt, less sodium, eating more potassium, and eating healthier kinds of fats. So, fat from fish is healthier for your heart and your blood vessels. Fat from things like avocado, healthier for your heart and blood vessels. So, eating healthier kinds of fats. Those are things we can do for our diet to help blood pressure. Another thing that can affect blood pressure is being sedentary, so not exercising. Exercise helps blood pressure. As we exercise, we release substances that help the blood vessels to relax. So regular exercise brings the blood pressure down, and a sedentary lifestyle predisposes to high blood pressure. Aim for at least 30 minutes of exercise at least 5 days a week. More is better, but this is a minimum. And this is on top of your regular activity, going up and down from work or up and down from school, going to the grocery store and things like that. We're talking about an additional at least 30 minutes of intentional exercise at least 5 days a week. That will help. We also look at excess weight. So, independent of how we eat and our physical activity, we know that the more you weigh, the more stress it is on the body, the more stress it is on your cardiovascular system. Your cardiovascular system is your heart and your blood vessels. So it's more stressful on the cardiovascular system. And so it can cause the blood pressure to be high. So taking measures to bring your weight down helps with blood pressure control. Another thing that can affect blood pressure is too much alcohol. Just too much of substance, so too much alcohol, smoking, illicit drug use. Cocaine is one that's really bad for blood pressure, but any kind of smoking, illicit drug use, a lot of alcohol, all of those things predispose, they make the blood pressure run higher. So taking measures to control those help to bring the blood pressure down. And then dealing with a lot of stress. So we all have stress in our lives, but if you're always, dealing with high levels of stress, days and weeks and months, years on end, that can make the blood pressure high. Stress also makes you more likely to be doing the other things, all the other things I've mentioned that make the blood pressure high. So when you're really stressed out, you don't eat well, you might not be exercising, might not be sleeping as well. Poor sleep can predispose to high blood pressure. You may be using alcohol or some illicit substances to cope with the stress. So managing stress is really important. This is one that we're not really good with in our our society and our day-to-day lives, but it's so important. If you've done all these things, then we look at adding medicines, changing medicines. We also look at other things, like we may start to look at, do you have risk factors that make us think you may have sleep apnea, and we screen for that. There's certain medicines that may make your blood pressure go high that we have to change. There are hormone problems, things like thyroid. If your thyroid level is too high, it can make your blood pressure go up. Some kidney diseases, some heart defects, those things we start to look at. But I really want us to focus on the things that we can control. So your diet, less calories, less sodium, more potassium, cut back on bad fats, and your exercise, in addition to your day-to-day life, minimum of 30 minutes 5 days a week of intentional exercise, getting good sleep, making sure you're working to keep your weight at a healthy level. Talk to me about what a healthy level is for you, but making sure you keep your weight at a healthy level, making sure that you're minimizing or avoiding alcohol, smoking, stop smoking, illicit drug use, stop that, and then managing stress. Those are things we can control. So those are things that we can work on one after the other to get better control of blood pressure.